Great. So welcome everyone. As I said, I'm the Policy and Advocacy Officer at the Environmental Rights Centre for Scotland, and I'm delighted to be joined today by Professor Jill Belch, who's the Chair of Vascular Medicine and Cardiology at the University of Dundee, and also the co-chair of the Royal College of Physicians of Edinburgh's Working Group on Air Pollution. But we're also joined by Communities Against Woodsmoke, a grassroots campaigning organisation in Scotland working to raise awareness on the harms of wood burning on our health and the environment. Unfortunately, the speaker, Mandy, couldn't be with us today, but we've got a pre-recorded presentation that we'll be sharing instead. And you'll be able to find out other resources from their website, which we'll share at the end. And finally, we're also delighted to be joined by Dr. Malcolm White, Clean Air Specialist at Global Action Plan, an environmental charity who are at the organisation behind Clean Air Day, which is happening this Thursday on the 22nd of January, and is the UK's largest air pollution campaign. They also manage Transform Our World, which is a community of 7,000 teachers empowering students to take climate action. So before we get into the main part of today's presentation, I'm just going to briefly introduce Environmental Rights Centre for Scotland, what we do. So our vision is of a Scotland where every person's right to a healthy environment is respected, protected, and fulfilled. We do awareness raising of legal rights and remedies to support equitable participation in environmental decision making, especially of the most marginalised and underrepresented groups within Scotland. We undertake advice, assistance, and representation to increase access to justice and to hold public bodies and polluters to account. We undertake policy and law reform to improve environmental law. A primary part of my work is campaigning for a legal right to a healthy environment in Scots law, which would include, for the first time in Scotland, a legally enshrined right to clean air. And that's where a lot of campaigning in this area has been coming from. And finally, we undertake strategic public interest litigation to tackle systemic environmental problems. And we have recently launched our own environmental law centre, which means that we'll be able to take our own legal cases forward within Scotland and challenge public bodies and polluters in court ourselves. So today we'll be covering three principal areas. Firstly, trying to understand what the primary causes of air pollution are in Scotland, trying to understand the impacts of air pollution on our health and also the health of our planet and environment. And finally, considering what policy changes are needed so that we can address persistent air pollution to try and improve air quality and to guarantee our right to clean air. And just very briefly, I'm just going to touch on some of the issues around air pollution in Scotland. We have seen good improvements in recent years in air quality with the introduction of things like clean air zones and kind of restrictions on polluting vehicles in cities, which our speakers will go into in more detail. But we do still see pollution from transport, industry, and domestic heating and cooking, which remain significant problems. And just to illustrate this, ERCS is free advice service, which takes inquiries from members of the public across Scotland. We've received 10 inquiries about air quality and air pollution since its inception a couple of years ago. So that should give you a bit of an overview of what we'll be covering today. Now going to hand over to our speakers who will be speaking in more detail about these issues. And we'll be concluding with a short Q&A. So if you have any questions, please do post them in the chat and you'll also have the opportunity to raise them directly to our panel. But I'll be collating those questions at the end. So I'm going to conclude my part of the presentation and hand over now to Professor Jill Belch. Over to you, Jill.
Thank you. Just sharing my screen. There we go. Great. Well, thank you very much indeed, Benji, and to ERCS for the invitation to talk about the health and policy impacts as relates to work in Scotland. Air pollution is really a silent killer, And across Greater Europe, we have 790,000 deaths a year related to air pollution. And to put that into perspective, global malaria deaths are 650,000. So it is really a killer, mainly heart disease and lung disease. And that translates to about 40,000 in the UK, and Public Health Scotland have done some work which suggests that 2,700 people die every year in Scotland because of air pollution. Now, people are quite surprised about this. Air pollution hasn't reached everybody's consciousness, and even my medical students are quite surprised when I show them that air pollution actually kills more people in the UK than obesity, which we hear so much about. So it is a very worrying situation to have high pollution levels anywhere. Now, we first had a policy development following the Great Smog of London, and you can see some of the pictures here. People couldn't even see, they could hardly breathe. And if you look at 1951, before the Great Smog, you can see that the smoke and sulfur dioxide levels were quite low. But between the 4th of December and the 10th of December, you can see how they increased in 1952. Unfortunately, we've become quite familiar with these death graphs, and here you can see deaths in the previous 5 years and the deaths from the Great Smog in 1952, where about 4,500 people died during the episode. Further work over weeks and years afterwards showed that probably about 40,000 people had effects on their deaths, promoted their deaths from this one episode of smog. And that is 1 in 2,000 people 1 in 200 people who lived in London at that time. So very devastating. And that brought in the first Clean Air Act into the UK. Now, what are the main air pollutants? Well, we've got nitrogen oxide gases, which we call NOx, NOx. We have particulate matter, which is less than 10 microns in diameter, so very small. And we have particulate matter less than 2.5 microns in diameter. And to put that into proportion, this is a human hair, 60 to 70 microns in diameter. And those little teeny weeny black spots, that's PM 2.5. So very small compared to a grain of pollen and a grain of sand. There's also ammonia, sulfur dioxide, carbon monoxide, and ozone, which will be dealt with by some of the other speakers. But what I would like to focus on are these three. And the reason for this is that they cause a lot of health problems, but also they're the ones that our local councils measure in terms of quantifying transport air pollution. So what does NOx do? Well, NOx is made up of predominantly NO2, the gas, and also NO. And NO2 is really very damaging. It's irritating. It irritates the eyes. It irritates the mouth, the nose, the throat. It irritates the skin. And when it gets to the lung, it damages the lung. And then it's gone into the bloodstream where it affects the brain, the heart, and the immune system. So NO2 is not nice. And that's why we limit it. And at the moment, the legislation that applies to Scotland is the EU Air Quality Directive for NO2 from 2008. And the limit that they can have 1 year in one place is 40 micrograms per meter cubed. However, in 2022, the World Health Organization presented a dossier of very convincing scientific evidence suggesting that anything over the level of 10 was damaging to health. What about PM10 and 2.5? Well, PM10 isn't trapped by the nose, goes into the lungs where it is trapped, and it causes bronchitis, COPD, and cancer. 2.5, however, is small enough to pass into the bloodstream where it damages the lining of the blood vessels. They become stiff and we get high blood pressure. They become inflamed, and inflammation causes hardening of the arteries that in medicine we call atheroma. And this hardening of the arteries extends to the brain with stroke and dementia, angina, heart attacks, gangrene, and amputation. And because the blood vessels are inflamed, the blood rubs up against them and begins to clot, so you get blood clots. And of course, we also then limit the levels of these compounds. And again, England and the rest of Europe follow the air quality directive. So their limit is 40 for PM10. However, Scotland in 2006, when the first WHO document came out, limited their PM10 to 18, which is excellent to have seen. The WHO, however, in 2022 are lowering the levels further to 15. And a similar thing can be seen with 2.5, the rest of the UK and the EU, 25 is the limit. In Scotland, we're at 10, but now WHO says that anything over 5 will damage health. And what I want to show, go back to the first slide, is that if you look at the proportion of population in Scotland to England, we should actually be having about 3,700 deaths. And we don't, we have 2,700, which means our better quality control is likely to be saving us 1,000 deaths per year. But we still have exceedances, and air pollution affects us womb to tomb. Here you can see the baby in the womb suffers a lot: low birth weight, premature birth, stillbirth, and organ damage for babies whose mothers live in high air pollution areas. And remember, this organ damage is permanent, and so we're already disadvantaging these children for the rest of their lives. It's not much better once you're born, your brain is affected, and it's been estimated if you live in a high air pollution area, your baby will lose 1 standard grade because of brain damage. Lungs are affected, as are the immune system. And once you get to childhood, more A&E visits, your lungs are damaged, and there's a higher death rate, twice as much before the age of 2 years. And again, worryingly, continued fall in brain development, which disadvantages these children for the rest of their life. Intelligence down, coordination, behavior problems, memory, and depression. And adults don't escape: asthma, type 2 diabetes, heart attacks, and when you become older, dementia and lung cancer. And you may say, well, that's maybe the rest of the world. Scotland's got these good levels. However, here's recent work from Scotland from 22 until the current time. Long-term exposure to air pollution increases mortality in Scotland. If you live in towns and cities, you have a much poorer outcome. If you're pregnant, it can affect your health. It can affect the health of your baby. Along with noise, it gives you hypertension. And our own work from Tayside, looking at hospital admissions, shows if your pollution is within legal limits, you have a small number of hospital admissions. But as soon as it goes above legal limits, you increase hospital admissions. And here you can see how it affects our elderly also. So disadvantaging certain groups within the population. And I want to make the point that it's not just living chronically in an area of high pollution, but bursts of air pollution actually cause problems, as we've shown in Tayside with hospital admissions. And here's another one showing short bursts are very harmful. And of course, that's important with car engine idling. We've all seen people idle their engines, and every minute you release enough toxic emissions to fill 150 balloons. And what people don't realize is that your air pollution is much higher within your own car than it is in the pavement. And I see people outside schools sitting, waiting for their children with babies in the car, and the air inside the car is obviously polluted as they try to keep warm by idling their engine. Now, it is illegal to have your engine idling, but only if you refuse to switch it off when asked to by an authorised enforcement officer, which unfortunately is not a member of public. So the offence is failing to stop idling when told to do so, not actually idling. And what this means is that hardly anybody ever gets fined. And between 2021 and 2024, there was only a single fine. Glasgow since then has now fined 3 people, but Edinburgh Council has fined no one in 20 years, despite receiving hundreds of complaints about car idling. One good thing, however, a lot of the councils are now waking up to the dangers of idling outside schools, and you quite frequently now see these notices pinned to the school railings, which is a very good sign. Remember, air pollution affects the most vulnerable. It affects us all, but it affects the most vulnerable predominantly. And of course, areas of deprivation often line busy main roads. And what people who were fighting against London's ULEZ didn't realise, that 40% of the people that live in that area don't even own a car, and yet they were being forced to breathe other people's poisonous smoke. There's also an ethnic divide, more prominent in England, where ethnic minorities tend to live nearer to the roadsides. The ill are worse affected because their organs are already damaged. The elderly are already damaged by age. And of course, babies and children have these dividing cells, which when damaged, never recover. Because children are so vulnerable, the Royal College of Physicians Edinburgh decided to have a look at whether our children were actually having their air quality monitored. We looked at all the schools in Aberdeen, Dundee, Edinburgh, Glasgow and Perth, and these are the combined results. And what you can see that in all primary schools, only about 5% were within 100 metres, and only 2% of our secondary schools. And you have to be within 100 metres to get accurate readings of air pollution. So we're trying now to get funding to put up air quality monitors, but understandably that has proven quite difficult. And it's not just the cost to you as a person and your health, but it's the cost to the UK through, of course, NHS and social costs, but also working days lost and benefits paid. So it is a huge cost, about 2.5% of UK's GDP. So is it all doom and gloom? No, it's not. Here is a snapshot of the west coast of America during COVID and before COVID, and you can see how pollution has fallen when we don't drive our cars. We know that when Ireland banned coal, Hong Kong banned sulfur fuel, heart disease rates dropped. The Atlantic Olympics reduced traffic, so the German reunification, and childhood respiratory disease fell. So we do know that lowering levels improves health. And here's our results from in Scotland since 1990, and you can see fantastic how all the pollution levels, apart from ammonia, has actually fallen. But what I'd like you to look at is the past 10 years. And what you can see that from 2015 onwards, this is really now a flat line. And we do, therefore, need the introduction of our low emission zones. This is Dundee, and the UK and particularly Scotland are actually quite late to the low emission zones, and therefore we don't really have any evidence to support them yet, although our group are looking at the effects on hospital admissions of our 4 LEZs. But what we do know is that in London, children started to walk and cycle, work absences fell, and work productivity went up by 20%, levels of depression fell. In Tokyo, child deaths fell, and in Paris, a penumbra of low pollution happened roundabout because of people driving to the LEZ in better cars. One of the worries is, will the businesses lose money? And in fact, in China, when they looked at all the returns a year for the taxes, they found there was an initial drop, but actually it very quickly returned to normal. In the USA, less medicines required and cardiovascular deaths fell. So they do work. And there are other things too that we need to look at, promoting electric vehicle use and public transport. Since COVID, the public transport accessibility has fallen quite considerably, which is extremely disappointing. We need to take freight from the roads. One train can carry 70 lorry loads of freight. We need to target areas where vulnerable people congregate, schools, care homes and hospitals. We need to lobby for the newer WHO guidance adoption to our government. And we'll be hearing about some other sources of pollution next. But importantly, we do need to take people with us. And this is an interesting study where people are asked if they shouldn't smoke in highly populated areas where other people have to breathe their cigarette fumes. And you can see that nearly everybody agreed this is a bad idea, and the 20% or so smokers were probably the ones that disagreed. But if you ask the same question, but it's driving in heavily populated areas where other people have to breathe the car fumes, you can see it's reversed. And only 17% of people felt that was a good idea, despite the figures that I have shown about the death rates in Europe, Scotland, and the UK as a whole. So we do have some work to do. So in conclusion, Scotland has the tightest upper levels in Europe. That is fantastic. And our levels have improved, but we still have exceedances. And although we focus on annual averages, we really should also be focusing on short-term bursts, which are very dangerous. We really do need to introduce these new WHO levels because pollution is still harming and killing in Scotland. Thank you.
Thanks, Jill. That was really illuminating. We're now going to move on to a presentation from Communities Against Woodsmoke. As I mentioned, they couldn't be with us today, so we've got a pre-recorded presentation which I'm going to share with you now. Bear with me just 1 second.
Hello and welcome to our presentation. Communities Against Woodsmoke is a grassroots voluntary organisation set up to give a voice to all those...
Sorry, Benji, there's a bar across the middle there if you're able to remove that.
Oh.
...of the health
and just
environmental impacts of wood burning, and to campaign for legislation change that will give everyone the right to breathe clean air free from wood smoke pollution. This pollution can be broken down into two types: indoor burning from wood burning stoves and biomass boilers, and outdoor burning such as bonfires and fire pits. For the purposes of this presentation, we'll be talking about indoor burning specifically from wood burning stoves, since these are currently the biggest source of wood smoke pollution, and their use is increasing every year. So what's wrong with wood burning stoves? Wood burning stoves are several hundred times more polluted than gas central heating and produce more CO2 than burning oil or gas for the same amount of heat. All wood burning stoves produce huge amounts of health-harming PM2.5 particles. This is true of even the most recent models of stoves called eco-design. PM2.5 particles and the smaller ultrafine particles are produced and breathed in regardless of whether wet, dry or seasoned wood is burnt, with some models of stoves being worse than others. Ultrafine particles are 1,000 times smaller than the diameter of a human hair and are therefore invisible to the naked eye. But if you're smelling burning wood, then you will certainly be breathing these particles in. In 2023, domestic combustion, which covers the burning of wood, coal, solid smokeless fuels and fuels derived from waste such as coffee logs, produced 20% of the UK's PM2.5 pollution. Road traffic contributed 21%. 11% of this figure was just from burning wood indoors. Wood burning is increasing every year, with 1.9 million homes now having a wood burning stove. Thousands more are installed in holiday lodges and glamping pods. But only 8% of people burning wood are doing so out of necessity. The other 92% do so for aesthetic purposes or in addition to other heat sources. We moved away from burning solid fuels in the 90s and 2000s, but that figure has started to rise over the past 10 years, with the share of UK households now using solid fuel to be around 11% in 2022-23. According to the Stove Industry Association, 200,000 wood-burning stoves were sold in 2021. In 2022, sales rose by 40%. That trend continued in 2023, with over 86,300 units sold between Jan and June, so this is a trend that is rising. So how does wood burning affect communities? Because so many more wood-burning stoves are now in use, and the flues are often installed very close to neighbouring houses, smoke and fine particle pollution will drift into neighbours' homes, and the closer the flue is, the more pollution is likely to enter. The ultrafine particles we mentioned before come into houses despite doors and windows being closed. This means that people are having their health damaged in their own homes through no fault of their own. Homes with wood-burning stoves are on average 3 times more polluted than those without. Because house chimneys are relatively low to the ground compared to the chimneys from factories or incinerators, the impact on health is greater as the pollution is being produced much lower to the ground, and because of temperature inversions in winter, this polluted air remains trapped at ground level for many hours on end, long after the wood-burning stove itself has been extinguished. Wood smoke also travels very far. For example, burning 1 kilogram of wood will pollute 1 million metres cubed of completely clean air and 10,000 metres squared up to 100 metres in height. This slide shows readings from an air pollution sensor on the house of one of our members. The flue is about 8 metres from the windows of the neighbouring property. As you can see, the peaks of PM2.5 pollution stay high for extended periods of time, even though they go lower when they are averaged out over a week or so. Looking at the averages gives the impression that there is not a problem with pollution. These averages are what local authorities and governments use to make decisions on air quality, which is why it can seem that there is no pollution problem, when in fact there is, because it's the spikes of pollution and their duration that are causing the health problems. People are breathing in heavily polluted air during these prolonged spike periods and will be experiencing poorer health outcomes as a result. Here are a few quotes and experiences of a few of our members who have been living in neighbourhoods where people are burning wood and other solid fuels. My children can't play outside at weekends anymore because of wood smoke coming from other homes in our area. The smoke from my neighbour's chimney enters my home even when the windows and doors are closed. It always gives me a sore throat and cough. My child has asthma and we have to keep the windows shut all the time during the colder months because of wood smoke from neighbours around us using their wood-burning stoves. I dread autumn and winter now because I know I'll be spending every night struggling to breathe because of wood smoke from all the wood-burning stoves in my neighbourhood. I have to drive 5 miles every night just to walk my dog because my neighbourhood is so full of wood smoke that I can't breathe properly. More and more wood-burning stoves are being installed in my area, making it impossible for me to ventilate my house at any time of the year. I was only outside walking my dog for a few minutes, and now we are both having difficulties breathing. My clothes, hair and my dog all stink of smoke. There are wood-burning stoves on either side of my house and opposite. My wife now has asthma. The smoke comes straight into our house, causing us both lots of mental and physical distress. We live in a rural area and the smoke from our neighbour's wood burner comes into our house when it's on during the day and night. My son has asthma and is struggling to breathe with it. My life and enjoyment of my own home has been severely impacted by the constant wood smoke pollution from properties around me. Wood smoke harms our health in many ways because of the multitude of toxic chemicals released when wood is burnt. Chemicals in wood smoke have been linked to cancer, asthma, COPD, dementia, stroke, heart disease, low birth weight and learning difficulties in children. Wood smoke contains many of the same carcinogenic chemicals as tobacco smoke. A recent study over 8 years showed that people using wood-burning stoves had poor lung function akin to that of a heavy smoker. Sticking with the comparison between cigarette smoking and wood burning, this slide shows comparisons made between burning 1 kilogram of wood and the number of cigarettes you would need to smoke to be exposed to the same amount of chemicals. If we take benzene here as an example, the amount of benzene being produced by burning 1 kilogram of wood is the same as the amount of benzene produced by 6,500 cigarettes. We banned smoking from indoor venues as we were aware of how bad it was for everyone's health, and yet wood-burning stoves are sold without any health warnings. This is what we would like to see the government and local authorities doing to protect everyone's health from this growing and avoidable source of pollution. Launch a public health campaign to raise awareness of the health harm from burning solid fuels in wood-burning stoves and fireplaces, and educate health professionals on the health harms of solid fuel burning. Label wood-burning stoves and fire pits as harmful to health to better educate consumers. Planning permission should be sought for anyone wishing to install a wood-burning stove on any property. This must involve consultation with residents in neighbouring properties. Phase out domestic burning for those who do not need to burn. And finally, these are the references and scientific papers that correspond to the facts in our slides. Thank you.
Okay, so that was Communities Against Wood Smoke. If you have any questions, please just post them in the chat and we'll be coming back to them at the end. I'm now going to pass over to Dr. Malcolm White from Global Action Plan to conclude our this part of the webinar. Over to you, Malcolm.
Thank you, Benji. And it's great to follow 2 excellent presentations like that. I particularly enjoyed the strong but perfectly accurate messaging from Communities Against Wood Smoke. So I'll just bring up my slides now. Okay, that looks like it's come up okay. So yeah, thank you very much for having me along to speak. My name is Dr. Malcolm White. I work with the charity Global Action Plan, and I've worked with them for about 4 years, and we've done lots and lots of work in the air pollution space. As you heard, we've run Clean Air Day, which is the UK's biggest day in the fight for cleaner air, in terms of advocacy and community groups and health boards, schools, everyone up and down the country doing lots of work. And so that's on the 3rd Thursday in June. So that's the sort of big Clean Air Day campaign. And in a minute, I'll talk about Clean Air Night as well. But I think you could probably summarize a lot of what's been said so far in respect to air pollution and the impacts on health is that air pollution truly does impact us all. Jill was mentioning how it affects everyone throughout the whole of their life course, from before we're even born until after, until the end of old age. And it affects everyone, irrespective of where you live, but depending on where you live, it can have a higher level of impact on people. So it is a significant issue, as we've heard. I'm just going to talk a little bit about clean air night, which is, I think, partly why this webinar was designed to be at this timing, because on Thursday this week we have the sister campaign to Clean Air Day called Clean Air Night. This has only been going for 3 years now, but it's a growing strength to strength, and the idea behind this is to really highlight the issue of solid fuel burning, or forest fuels as we call them, and the impacts that has on health. Yeah, so there's lots that we can say about that, but because we've heard a presentation about wood burning, I will not focus on that fully for this, my presentation. But if you do want to find out more about it, you can essentially Google Clean Air Night, or in fact I think that's going to go up in the chat at some point as well. But if you Google Clean Air Night, you'll be able to find lots of resources in terms of things you might be able to share on the day with your organization or to your friends and family. There's communications pack to go on that. We've had research which came this year, which looks specifically at the impacts of domestic burning on the NHS in terms of numbers of patients admitted, people who unfortunately die as a consequence of wood burning, and the financial implications to the NHS as well. And there are lots of other organizations who have become supporters of Clean Air Night, so please feel free to join them. And we've had a lot of quotes from people who have recognized the consequences and the symptoms that they face due to air pollution. And just to add one more into the mix, when we had people come round, and if they had asthma or any respiratory problems, we found that we couldn't use the wood burner. And I then started thinking, well, maybe I shouldn't be using my wood burner as much as I do. And that was when I did a bit more reading and heard about how wood burners operate. So Tony in Hertfordshire. And so I think the idea of, just to finish out on talking about wood burners, is that many people are not really aware of the health harms associated with the burning of forest fuels, because they might they might feel the coziness factor, the sort of aspirational, almost middle class element of wanting to own a wood burner, and yeah, they're not necessarily aware of the health harms. So that's why campaigns such as Clean Air Night are particularly important. So moving on, and now, yes, we've already heard about many of these different types of air pollution, and Jill focused on nitrogen oxides and particulate matter. So I'm going to talk a little bit about different sources, sort of how you'll find them around the home, and also in the outdoor space, but also I'll focus a little bit more on ammonia and sulfur dioxide. You might remember from Jill's graph that pretty much all the air pollution sources in Scotland have gone down quite significantly in the last 25 years, but actually one of them, really quite stubbornly, has stayed up, and that's ammonia, and go into that more now. And yeah, essentially with ammonia, the major source of ammonia in the UK is relating to our farming practices, which is to say the excrement from farmed animals, and in particularly high density or factory farming, where there's lots of urine and feces running off from them. People will probably be quite familiar that this can be very polluting to rivers, with algal blooms and fish dying off and all sorts of things like that. But it's unfortunately very harmful to air pollution as well, because of the density of animals. And then also the spraying of fertilizers, the artificial fertilizers used in most of our farming up and down the country, really. And it's the fact that these farming practices haven't really changed. And it is an uncomfortable question to basically say that a lot of habits will need to change if we're going to seriously tackle this significant source of air pollution. Also, what's fair to say is that people will generally understand that living beside a major road or living in like an urban setting, it makes you much more likely to suffer from air pollution, and that is true. But it is not to say that there are no sources of air pollution in the countryside, and that indeed air pollution cannot be poor in the countryside. You'll know as you go past a field which is being sprayed and you can smell chemicals being sprayed or anything like that, then all of this would count as air pollution and would be an exposure, which would be harmful to your health. Which is not, in fairness, to only point a finger at the farming industry or anything like that as well. There are many other sources of outdoor air pollution. And in terms of these different like locations that I've got highlighted on the image, in many of them, it's quite a significant mix of particulate matter, nitrogen dioxides. But for example, if you're talking about industrial processes and construction and building sites, then there might also be quite a lot of sulfur dioxide created in terms of like heavy industrial processes or big heavy vehicles, which will use a different fuel type often. And indeed energy generation, which is to say generating our electricity grid, which is in the UK, thankfully, at least not using coal anymore, that still produces quite a lot of air pollution. Jill has already covered a lot relating to transport, which is super important. And we've also heard domestically in terms of how air pollution created from things such as wood burning and other fuels like that, actually, although we talk about indoor or outdoor air pollution, neither of those are completely within a vacuum. So it means that actually outdoor air pollution will travel indoors and indoor air pollution will travel outdoors. And that's because of natural ventilations of the building, but also we have one of the oldest housing stocks in Europe, really, which people may have heard before. Our homes are relatively leaky, which is also an issue in terms of the amount of energy that we're using in order to heat the homes. If the insulation and the ventilation is like not a good match. So anyway, there are lots of these different sources of outdoor air pollution. Another that I'm going to quickly focus on that we haven't mentioned is ozone. Now, you might be familiar with ozone in terms of when there's a layer of it, thin layer of it up in one of the upper reaches of the atmosphere, and you may have heard of the ozone layer. So that's an important, valuable layer which helps deflect radiation and has other purposes that are beneficial to us. And as we've decreased the use of certain chemicals in society, the actual hole in the ozone layer is slowly improving and shrinking. But ozone can also be created at the ground level. And essentially, this tends to be when you've got a mixture of different types of pollution and heat and indeed ultraviolet light, which chemically soups them, it mixes them together, and you can create ozone at the ground level. And ozone is actually particularly harmful to people with respiratory disease, and it is generally rather harmful to health. So that's just another one which is it's like a secondary pollutant which is created often as a consequence of different air pollutants as well. So we've mentioned nitrogen oxides there. Another one I will mention and talk about a bit more in the inside space is volatile organic compounds, or VOCs. And this essentially is a collection of 10,000 or so chemicals, which are often made by human processes, although not exclusively, and they're known to be harmful to human health. So they've all just been lumped together into this term of VOCs. Fine, so we carry on. And so, yeah, looking into the indoor air pollution space now, of course, and from what Jill was saying in terms of the Great Smog of London, there has historically been a great focus on outdoor air pollution, and that's partly because it's easier to legislate for the outdoor air pollution space, and governments are often afraid of legislating people inside their homes, so to speak. But especially with modern ways of living, we actually spend 80–90% of our days indoors in most cases. And that does mean that we can be exposed to significant levels of air pollution within the home or within offices and schools. And actually, there is an enormous amount of variability between different homes, and it essentially depends on people's behaviors within the homes. And so if there are some behaviors that can be changed in order to reduce air pollution, it does show that we can impact people's health and we can impact people's behaviors if we can encourage them to do some certain behaviors less and other behaviors more. And that's actually a lot of what I talk about in my work. I'm often educating health professionals about air pollution, and we're often trying to inspire behavior change in healthcare more broadly. But actually, the sort of changes that I try to encourage healthcare practitioners to be able to pass on are relatively simple, concrete changes that allow patients to be able to reduce their exposure to air pollution, as well as reducing the amount that they are contributing in the first place too. And so to go around some of the sources in the home, I've already mentioned about, say, burning things at home, and then particularly like log burning, wood burning stoves and the like, but actually burning candles at home, burning incense and things like that releases lots of fumes and smoke, essentially. So unfortunately, they are really quite harmful to health. And it would be worth advising people to do less of that, essentially. Try and keep it for special occasions, or if it has particular cultural significance to people, then trying to encourage them to do it as little as they can. And people will, if they become more aware of the issues, if they become more aware of these elements being harmful, then it might well be that they start to make changes. Because even as health professionals, I say this speaking as a doctor myself, we have not really been taught about this in, when I was going through university, and it's now great to speak with Jill and others who are actually leading education of medical students on air pollution, so that it's hard to expect that the patients will become aware of air pollution if say public figures and indeed health professionals, other groups like that, are not actually talking about air pollution. So that's often what we campaign for in the Global Action Plan way forward. Okay, sorry, I got a little bit distracted there. So we've already talked about burning things now, and lots of dust and other elements like that contribute to indoor air pollution. But also volatile organic compounds are found in lots of different sources and sites throughout the home. And some of the main ones that people might not think about would be paints and varnishes. So if you are going to B&Q or wherever you buy your paints, then you can ask for low VOC paints. And lots of things like, say, fire retardants, which is often things that you find in fabrics and cushions and carpets and other things like that, are unfortunately quite harmful to human health. So we would encourage people to ventilate after painting or changing their furniture. Lots of other things like hairsprays, nail polishes, cleaning sprays, all sorts of things like that. Chances are, if it has a strong smell, then it's going to be a bit harmful to human health, unfortunately. So we would encourage people to use cleaning sprays which are milder and have a less strong smell, less scented. And that is likely to improve the amount of air pollution being created. Last one in this area is talking about mold and damp. And these are significant issues in the home. Many health professionals will end up speaking to patients who unfortunately live in homes which are actively, reducing their health. And that can be another thing that I want to reference earlier is people have talked about there is a great health inequality relating to air pollution, in that people often who have circumstances beyond their control, if they live in, say, social housing or rented accommodation, but don't have the power or the money to be able to change their circumstances, then it means that there is a great inequality relating to these sources of air pollution. And one last one that I'm going to come on to talk about in slightly more depth is actually cooking. Now, everybody's got to cook their food, and as you heat up food and vaporize fats and things like that, you do create some air pollution, unfortunately. And so we would generally encourage people to ventilate when they're cooking, either using the extractor fan, which hopefully actually extracts to go outside, Or if you don't have an extractor fan, then trying to open your windows essentially when you're cooking, because say roasting a joint of meat can make your kitchen something like downtown Delhi in terms of the levels of air pollution, which is quite a difficult situation to be in, of course. And one area in particular is actually the source of heat or energy that we're putting into our cooking. So in particular, I'm going to skip past this because I haven't now talked about health inequalities and it's been mentioned already on the call. I'm going to talk about a little bit about gas cooking, essentially. And gas cooking it's still in about 50% of the homes in the UK. Unfortunately, it is quite a significant source of air pollution. It leads to, many thousands of cases of childhood asthma across the UK each year. And it's something that, again, people haven't really thought about. And if people aren't aware about it, then they're not likely to make changes. It's something that the UK is very familiar with. It's one of the major sources of cooking that we've had for years and years and years. And people are often wedded to their gas hob. But actually, as they become more familiar with different technologies, which are actually now superior in terms of ability to control temperature and control the cooking experience, people will gradually be moving away from gas hobs. But at Global
Malcolm, sorry,
Action,
I'm going to need to ask you to wrap up so that we have a bit of time for Q&A, if that's all right.
yep, no problem. I'll finish the slide, and I think I've got a couple that I'll skip past. Thank you.
Okay, thanks.
So yes, at Global Action Plan, we are pushing for legislative change to sort of rapidly transition away from the gas cooking space, because there are many ways in which gas cooking is harmful to human health, and there are better technologies already available, and it will contribute to our overall decarbonisation plans as well. So in the interest of time, I'll be skipping on past, but you can see that local authorities have commitments on air pollution. So if you have issues with that, you could speak to your local authority. And in the Scottish political context as well, of course, we have elections in May of this year. So that is an ideal opportunity to make sure that we bring air pollution discussion into the election space, which is a great advocacy opportunity. Source reduction is key, but it will need policy changes in order to support it, as we've heard in other discussions. And then that's me. And you've got my email address there at the bottom. But one website we'd like to help focus people towards is called the Clean Air Hub. And this is a place where members of the public can find out more about air pollution. It's sort of government funded originally from UK government. And so if you're a health professional wanting to direct your patients towards more information, I would recommend the Clean Air Hub.
That's great.
Anyway,
Thanks, Malcolm.
thank you.
That was really informative. We're going to move now to the Q&A. We've had a few interesting questions and comments in the chat. The first one was around whether the balance is right in terms of focusing on outdoor air pollution and air quality when indoor air pollution can be up to 5 times more polluting. And I know, Malcolm, you touched upon it being more difficult to legislate and regulate in domestic settings, but given that that might impact, for example, schools, do you think we need to be paying more attention to indoor air quality and what else could be done in that area?
So yeah, do you mind if I jump in on that one? Thank you, Benji and Jill. So just very quickly is that there is more research gradually being done on the indoor air pollution space, whereas historically we didn't do as much. And so that's really welcome to see. And then that does allow policymakers to make stronger decisions, we would hope, on this as well. And also recognizing that, it is a wider public health issue, and there is lots of action that, even if someone can't stop using their car, for example, in order to lessen the amount of air pollution that they're creating, there are likely to be some things that they can do. And in most cases, some of those actions would be in the home. So I think that there is definite strength in legislation that will impact on indoor air pollution spaces, including the limiting of domestic burning.
That's great. I've got another question. Maybe Jill, you can respond to this, which was around the fallout from combustion during the incineration process with incinerators for waste and the impact of that on air pollution. Do you want either of you want to come in and comment on that?
Yes, I'm happy to comment. I don't know if any of you saw the Ferret report in October last year, which showed that emissions from incinerators have doubled in the past 5 years. And of course, when you burn anything, you get air pollution that will damage you. But in particular, there's actually different pollutants. So you get arsenic, you get chromium, you get ammonia, and these are very damaging to health. In Scotland, we have a temporary moratorium on new incinerators, but we really need to make that moratorium permanent. There's a lot of studies that have shown that actually burning waste is very inefficient and that a lot of what is burnt can actually be recycled. So yeah, and if you look at the literature, a lot of worrying things about people that live near incinerators, a slight increase in congenital heart disease, a slight increase in genital malformations. So yes, it is something that we do need to look at. Quite frankly, we need to look at anything that burns. We're obviously experiencing wildfires, and you can't really help those, but those are causing huge air pollution. The air pollution in America, the PM 2.5, went up over 300. Remember, the recommended level is 5 from the air coming down from Canada. But we can do things in Scotland. We do need to look at muir burn, that is the burning of areas for grouse, because nobody is warning people to keep their windows shut. As you heard, windows leak. And we do need to look at whether this burning is appropriate in a country where we know that air pollution comes from burning anything.
Great, thanks, Jill. So I have another question which came in, which it would be interesting to hear both of your thoughts on. Do either of you have any comments on the potential contribution of district heating systems to improving air quality by replacing fossil fuel heating appliances? So, for example, the person raising this mentioned that 70% of homes in Denmark are now on district heating systems, and presumably that's had some impact on air quality. So, do any of you have thoughts on that?
I'll let you go first, Malcolm.
Yeah, cool. Thank you, Jill. So I will actually say that this question was discussed, I think, in advance as well. And actually, Mandy from Communities Against Woodsmoke did some research on this, which was very appreciated. But yeah, I think as a concept, district heating is absolutely amazing. You know, I think it has great energy efficiencies, and yeah, like there is a lot of good to be said about them. It is not automatic to say, however, that all community heating sources essentially will use sustainable heating in them. It is certainly quite common and possible that a lot of the district heating sources will be using fossil fuels or other forest fuels, etc. So it really does depend on the heating source, and you know, otherwise, generally, I would consider myself on board.
Yeah, I would agree. Just one area of policy that we really do need to address in Scotland, and that is the data centres. In some areas, the data centres are being mandated to put their excess heat, of which there is a lot produced, into local heating initiatives, which is excellent.
Yes.
What we need to do is we need to mandate that they should have solar panels or wind farms near to them, providing the huge amount of energy that they need, but also some way of benefiting the local communities with the heat they produce. And if there's anyone here from Edinburgh, that's where you should start lobbying, because there's going to be a huge data centre built there. And I suspect a lot more will come to Scotland. So get ready to lobby now.
Yeah. And even if I just jump on that excellent point from Jill, is that Global Action Plan on Thursday are taking the first court action relating to data centers in the UK, and that's going to be it's really just highlighting, okay, AI is here, there are many positive aspects, there are lots of negative aspects, but the government hasn't really thought through the environmental implications of the data centers. And many of, like all data centers, basically have diesel generators as backup, and they will all fire about once a month, just to make sure that they're still working. And of course, they are extremely energy draining in terms of the amount of energy required as well. So there are significant issues there that need to be addressed, and sharing the heat generated from them into community heating sources seems like an excellent thing that we've seen in Scandinavia and other places.
Thanks so much. We're going to have to wrap up there. I'll just mention very briefly the data center point is really pertinent, and ELCS has also been doing some work in this because we've identified that there haven't been requirements to do environmental impact assessments for some of the proposed data centers in Edinburgh. And APRS, another Scottish charity, is also planning to do work on this. So there is going to be a growing amount of campaigning in this area. So keep your eyes peeled for that. And also just flag very briefly, ELCS has been working with Jill and others on a campaign around engine idling to ensure better enforcement of engine idling law to limit, in particular, outside schools and hospitals, pollution from stationary vehicles which leave their engines on. So if you're interested, there's information about that on our website. Um, it's been a really interesting conversation today. I'm sorry we haven't had time to follow up on all of the questions which was coming in, but I think the amount of comments and questions speaks to the concern around this issue and the fact that there's a real opportunity to build more public campaigning and awareness around this. So I would encourage everyone to speak to your candidates if you live in Scotland for the upcoming elections in May and raise these issues. And yeah, just to conclude, I think we've highlighted how air pollution is not only an environmental risk, but also a major public health risk in impacting uh, public health in terms of all of the organs in the human body being impacted by air pollution. Around 30,000 deaths every year in the UK. But also, we know that air quality and climate change are interlinked through the release of greenhouse gases and aerosols. And there's a win-win scenario by addressing all of these sources of emissions. And so we need rapid changes now to guarantee our right to clean air in Scotland through cutting use of polluting vehicles, slashing industrial and business emissions, and restricting wood burning in domestic uses. And there's obviously many other areas we haven't been able to go into. But thanks so much for your time coming today. Thank you to our great speakers, Malcolm, Jill, and also to everyone at Communities Against Woodsmoke for trying to raise awareness about these issues. Please do stay in touch with ERCS. We have a newsletter. We'll also be putting a recording of this webinar out on our YouTube channel, so you can access all of the resources in here, and we'll be sending out a feedback form as well. So please do let us know how this event was for you and if there's anything we can do to improve. Thanks again for your participation, and we hope to see you again soon. Goodbye.